I'm Peter and I'm the author of Mindfulness in 3D, the Alexander technique for the 21st century. I thought I'd make a couple of videos about the two things that the Alexander technique is most famous for, back pain and posture. This one's about back pain. After a 4-year trial of the Alexander technique for back pain, costing about £800,000, the British Medical Journal concluded that the Alexander technique was highly effective for back pain and that the benefits were still evident a year after the patients had stopped their Alexander sessions. They said that the Alexander technique, coupled with gentle exercise, which was walking, seems to be the most effective and cost-effective option for the treatment of back pain in primary care. For me, there are two interesting things about this. One is that we don't actually treat back pain, and the other is that although Alexander is the most effective option, or the evidence is that Alexander is the most effective option for back pain, everyone comes to me after they've tried all the other options. They've been to the physio, they've been to the osteopath, they've been to the chiropractor. As I said in my book, they could save themselves time, effort and money by coming for Alexander first. They could save themselves time and pain by coming for Alexander first. Why is it the most effective option? Well, precisely because it isn't a treatment for back pain. I watched a video where a medic explained why he likes Alexander for his patients. He said that in other treatments the patient is passive, whereas in Alexander the patient is active, taking part and learning. If you've got back pain, it's almost certainly caused by how you do things. So the best way to stop being in pain is to stop doing the things that cause it. For instance, if your back pain is caused by how you sit at your desk, you can get your back clicked as many times as you want, but the pain will keep coming back until you learn to do it differently. Getting your back clicked is a passive intervention. Learning to sit differently is actively intervening yourself. One of my clients told me he'd got a really good osteopath and he'd been going to her for 16 years. Getting rid of the pain, then going back to his desk and causing the pain repeatedly for 16 years. I taught him to sit effortlessly at his desk in a way that didn't cause pain. Remember, the British Medical Journal said it still has benefits a year later. I was helping man a stall at the Mindful Living show a few weeks ago. There was a body worker on the same stand as me. I saw her give a treatment to someone with neck pain lying on a massage table, and then I watched the client get off the table, pick up her bag and rummage through it to find cash to pay for the treatment, bending her neck at 90 degrees in a way that I can't do, undoing any benefit the treatment had given her. I would say that learning an easier, more natural way of looking at her bag would probably be more helpful than having the treatment. By the way, the opposite of doing this is not sitting up straight. It's not the standard idea of good posture. I'll cover that in the next video, along with explaining how core muscles don't exist. Your back pain may not be caused by how you sit at your desk. It may be caused by how you get out of a chair or how you bend your back to do things. Or it may be caused by a mistaken idea of how you should hold yourself or what the correct shape to be is. Alexander will show you how to do everything in an effortless, elegant way that fits in with how you're designed to be upright and designed to move. In my experience, quarter of a century of teaching the Alexander technique, when people learn this light, simple, effortless way of being upright and doing their daily activities, their back pain reduces and then goes. There are a lot of mental benefits too, and I'll cover those in another video. Alexander people look good. They look light and elegant, they come across well, and they look comfortable in their own skins. For instance, if you could rummage through your bag like that, or look at your phone like that, you could rummage in your bag like this and look at your phone like this. Which would you rather look like? If all this seems to be too good to be true, come and try it. Come and have a free introductory session. You'll know within a few minutes whether it's going to help you and whether it's worth pursuing.